Hi, Ray Sievert with Tracy Technologies. Today we're talking about PCO, posterior capsular opacification. It dogs a lot of us when the patient's happy, they've got good vision, but then their vision starts to decline, or even worse, you put in a multifocal and their vision's not very good from the jump. How do you use the iTrace to tell you whether or not it's appropriate to YAG the patient? Well, surprise, surprise, there is a way. This opacity grade, normally for cataracts, is 2.5 and higher. It's a cataract. It's pretty obvious to everybody. However, it's not clear to a lot of people that you can use this to see if the PCO needs to be YAG'd. So, in our lesson 12 of iTrace University, Dr. Sievert did a study looking at the opacity grade to determine when's the best time to YAG. I'll show you an example patient. So this is a patient I was actually fortunate enough to be in when the patient was coming in for a YAG, and we mapped the patient first. Let's see what we see. You see opacity grade is 2.0, the vision's very poor, and the patient's not happy, and the refraction's in red, meaning what? High order aberrations. And they have about a diopter and a half of nearsightedness and about a half a diopter of astigmatism. When you look at when this scan was done, it was done at around 7:45 in the morning. And then the next scan I'm going to show you was done at 9, literally moments after their YAG. Let's take a look. Now the opacity grade is 0.5. That's a lot different than 2.0. And their vision's better, but it's not great. I was told that that's probably because of all the laser energy in the eye, that the eye would quiet and clean up. But now look, the refraction's not in red anymore, it's in green. And now that minus 1.5 diopters of nearsightedness and the astigmatism, now this is easily correctable with glasses. So they're going to be plano with a little bit of sil, which they'll easily tolerate. And they're going to be super happy by the time this resolves. And so I thought that was really interesting, that you could actually use the opacity grade if it's 0.5 after surgery and the patient's happy, and then some months later they come back and now their vision's not so good, it's changed, you're not sure what to do. If the opacity grade has changed, it might be time to do a YAG on their capsule. And a lot of people say, well, it's easy to know. Well, not always. Sometimes the capsule doesn't look all that opacified, but when it fibroses, it does something to the lens. And when you release the tension on the bag, their vision will improve. So for what it's worth, I thought it was an interesting case and wanted to share that with you. Hopefully Dr. Jane's study will be out soon showing that the opacity grade actually indicates to her the appropriate time to do a YAG capsulotomy. So thank you for watching. And again, this is Ray with iTrace University. I hope you're enjoying the sessions. Thank you.